Welcome back to our channel. Today we're diving into the world of junctional rhythms. If you're a medical professional or just curious about heart rhythms, this video is for you. We all know that the heart is a fascinating organ, and understanding its rhythms is crucial for both diagnosing and treating various conditions. Junctional rhythms can be a bit tricky to comprehend, but don't worry, we're here to break it down for you. In this video, we'll explore the causes, symptoms, and treatments of junctional rhythms. We'll start by discussing junctional escape beats, move on to the causes of sustained junctional escape rhythms, and then cover the symptoms and risks associated with these rhythms. Finally, we'll delve into the treatments for both isolated and sustained junctional escape beats. By the end of this video, you'll have a comprehensive understanding of junctional rhythms and how to manage them effectively. So let's get started. Whether you're a seasoned healthcare professional or just starting out, this video will provide valuable insights into one of the many intriguing aspects of cardiology. Grab a cup of coffee, sit back, and let's dive into the fascinating world of junctional rhythms. Junctional escape beats occur in patients with sinus bradycardia, SA node exit block, or AV block. These beats typically happen at a rate between 40 and 60 beats per minute. When the sinoatrial SA node slows down or is blocked, the atrioventricular AV node steps in as a backup pacemaker. This is where junctional escape beats come into play. It's a safety mechanism that ensures the heart continues to beat even when the primary pacemaker fails. Interestingly, these beats may conduct retrogradely into the atria. This means that the electrical impulse can travel backward from the AV node up into the atria. However, the QRS complex often masks any retrograde P wave, making it challenging to detect. This retrograde conduction can sometimes be seen on an EKG, but it's not always evident. Junctional escape beats are usually benign and don't cause significant symptoms. However, they can be a sign of an underlying issue with the heart's conduction system. It's essential to understand this mechanism because it helps clinicians determine the appropriate course of action. For instance, if a patient presents with sinus bradycardia and junctional escape beats, it might indicate an issue with the SA node. In such cases, further investigation is warranted to understand the root cause. Keep in mind that while junctional escape beats serve as a protective mechanism, they also point to potential problems that need to be addressed. Understanding junctional escape beats is the first step in grasping the broader concept of junctional rhythms. Now that we've covered the basics, let's move on to the causes of sustained junctional escape rhythms. Sustained junctional escape rhythms can be a bit more concerning than isolated beats. These rhythms occur when the AV node takes over as the primary pacemaker for an extended period. Several conditions can lead to sustained junctional escape rhythms, including congestive heart failure, CHF, myocarditis, acute myocardial infarction, MI, hyperkalemia, or digoxin toxicity. Each of these conditions affects the heart's ability to maintain normal rhythm, necessitating the AV node's intervention. Congestive heart failure, for instance, can lead to increased pressure and stress on the heart, disrupting the SA node's function. Myocarditis, an inflammation of the heart muscle, can also impair the SA node, leading to reliance on the AV node. Acute MI, a severe condition where blood flow to the heart is blocked, can damage the conduction system, making the AV node take over. Hyperkalemia, an elevated level of potassium in the blood, can affect the electrical activity of the heart, leading to sustained junctional rhythms. Similarly, digoxin toxicity, resulting from an overdose of the medication digoxin, can increase the automaticity of the AV node, causing it to override the SA node's rate. Enhanced junctional automaticity can lead to accelerated or tachycardic junctional rhythms, further complicating the clinical picture. Identifying the underlying cause is crucial for appropriate management. Each of these conditions requires a different treatment approach, and understanding the root cause helps in tailoring the therapy effectively. Recognizing these causes not only aids in diagnosis but also in preventing potential complications. With a clear understanding of the causes, let's move on to the symptoms and risks associated with junctional rhythms. Symptoms associated with junctional rhythms can vary depending on the underlying cause and the heart's response to the altered rhythm. If the ventricular rate is too slow, it can lead to myocardial or cerebral ischemia. This means that the heart or brain may not receive enough oxygenated blood, resulting in chest pain, shortness of breath, dizziness, or even syncope, which is fainting. These symptoms are serious and require immediate medical attention. In some cases, junctional rhythms may alternate with the SA node rhythm, leading to bigeminal or trigeminal rhythms. Bigeminy refers to a pattern where every other beat is a junctional escape beat, while trigeminy involves every third beat. These alternating rhythms can be unsettling for patients and may cause palpitations or a sensation of skipped beats. It's essential to monitor patients closely for these symptoms, especially if they have a known history of heart disease or other risk factors. The presence of symptoms indicates that the junctional rhythm is not adequately supporting the body's needs, necessitating further intervention. Moreover, sustained junctional rhythms can lead to long-term complications if not managed appropriately. Chronic ischemia can damage heart tissue, leading to heart failure or other serious conditions. Therefore, recognizing and addressing symptoms early is crucial for preventing adverse outcomes. Understanding the risks associated with junctional rhythms helps clinicians prioritize treatment and monitoring strategies. Now that we've covered the symptoms and risks, let's explore the treatment options for isolated junctional escape beats. Isolated, infrequent junctional escape beats usually do not require specific treatment. These beats are often benign and act as a protective mechanism when the SA node slows down or fails to fire. However, it's crucial to monitor the patient to ensure that the beats remain infrequent and do not develop into a more sustained rhythm. In most cases, addressing the underlying cause of the slow SA node rate is sufficient. For instance, if sinus bradycardia is due to medications like beta blockers, adjusting the dosage or switching to a different medication may resolve the issue. Ensuring that electrolyte levels are within normal ranges can also help prevent isolated junctional escape beats. Patients should be educated about the significance of these beats and the importance of regular follow-up. While isolated beats are typically harmless, they can sometimes be a precursor to more significant issues. Regular monitoring and follow-up with a healthcare provider can help catch any changes early. If the patient is asymptomatic and the beats are infrequent, reassurance and observation are often all that is needed. However, if the patient experiences symptoms like dizziness or palpitations, further investigation is warranted to rule out other potential causes. In summary, isolated junctional escape beats are generally benign and do not require specific treatment. Monitoring and addressing any underlying causes are usually sufficient. Now let's move on to the treatment options for sustained junctional escape rhythms. If sustained junctional escape rhythms are producing symptoms, treating the underlying cause is the primary goal. This approach addresses the root of the problem and helps restore normal heart function. For example, if congestive heart failure is the cause, managing fluid overload and optimizing heart function can help reduce the reliance on the AV node. In unstable patients, immediate intervention is necessary. Administering atropine 0.5 milligrams intravenously every 5 minutes up to a total of 3 milligrams can help increase the heart rate by enhancing SA node activity. If atropine is ineffective, transcutaneous or transvenous pacing may be required to stabilize the patient's heart rhythm temporarily. Digoxin toxicity, a common cause of sustained junctional rhythms, requires specific treatment. Discontinuing digoxin and using medications like digoxin-specific antibody fragments can help neutralize the effects of the drug. Monitoring and correcting electrolyte imbalances, particularly potassium levels, are also crucial in managing digoxin toxicity. In some cases, more advanced interventions like implantable pacemakers may be necessary, especially if the patient has recurrent issues with their SA node. These devices help maintain a stable heart rate and reduce the risk of complications associated with sustained junctional rhythms. Ultimately, the treatment approach for sustained junctional escape rhythms depends on the underlying cause and the patient's overall condition. By addressing the root cause and using appropriate interventions, clinicians can help restore normal heart function and improve patient outcomes. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more medical insights. Stay healthy and informed. Understanding junctional rhythms is crucial for both diagnosing and treating various heart conditions. We've covered the basics of junctional escape beats, the causes of sustained rhythms, and the symptoms and risks associated with these conditions. We've also delved into the treatment options for both isolated and sustained junctional escape beats, providing you with a comprehensive understanding of this fascinating aspect of cardiology. Remember, Early detection and appropriate management are key to preventing complications and ensuring optimal heart health. If you have any questions or topics you'd like us to cover in future videos, please leave a comment below. We appreciate your support and look forward to bringing you more valuable medical content. Until next time, stay healthy and stay informed.